Hello, thank you very much for joining us for our Pride Conversation series, and happy Pride. I am Admiral Rachel Levine, the Assistant Secretary for Health at the United States Department of Health and Human Services, and the head of the United States Public Health Service Commission Corps. And it's so wonderful to be here today with Ms. Jane Clementi, who is the co-founder and CEO of the Tyler Clementi Foundation and an advocate for mental health and bullying prevention. Thank you very much for being here.
Thank you for having me. It's a pleasure to be
Absolutely.
here with you.
So we always start with some of the same questions. What would be one LGBTQI plus health topic that is important to you that you'd like to talk about today?
Sure. Well, the one topic that rises to the top for me is what affected our family personally. Yeah. And that is the aggressive, unwanted behavior or more commonly known as bullying behavior, that is disproportionately affects the LGBTQ community, and also the impact it has on one's mental health and well-being. That I think is key.
And can you tell us a little bit about your story and about Tyler?
Sure. So Tyler was a freshman at Rutgers University when he sadly made national headlines for all the wrong reasons, so to speak. His roommate live streamed him in a sexual encounter with another man, and then he posted about it on social media. And Tyler's reality became very twisted and distorted as he kept reading those posts on social media. And sadly, he made the imperfect decision, so to speak, a permanent decision to a temporary situation, as we like to say, because as his reality became twisted. Because on September 22nd, 2010, Tyler died by suicide. He was 18 years old at the time.
I'm so sorry.
Thank you.
Thank you. So you've been working on bullying prevention since that time with your foundation, with you and your family. Can you tell us about your work?
Sure. But we just have to make it clear that bullying is a very complex situation. Yes. And it takes multi-pronged approach to trying to put an end to bullying. And I think it includes some policy work, and that is legislation, anti-bullying legislation, right, which in 2010 was very far and few between. We've made some progress in that respect, but there's still not any federal laws. State laws, but not federal laws. Matter of fact, even New Jersey did not have a law in place until December of 2010. It was they were into conversation, and then with Tyler's situation, they passed a law quickly. So there is a piece of legislation called the Tyler Clementi Higher Education Anti-Harassment Act. It's been reintroduced every Congress. It just doesn't seem to be nonpartisan enough to pass. But I also think there's other ancillary bills like the Equality Bill that will be helpful to the LGBTQ youth especially. And we also have to understand that sometimes legislation can be the bully and can be a bully in situations. With the rise in Don't Say Gay bills and the transphobic bills and the book banning bills, which I am so opposed to because we have to share our stories. And it has such a positive effect to be able to read a story and to just grow in your own knowledge, but to see yourself in a book or a novel is so important, and our stories cannot be silenced. But again, legislation is only one piece. I do not like punitive legislation for anti-bullying. I don't believe in this 3 strikes you're out kind of legislation. I think we need more social emotional learning incorporated into these bills, such as behavioral modification, because if you just take someone who's using aggressive behavior in one spot and move them someplace else, all they are is going to be a problem there without any kind of interaction or intervention. We need intervention. So that takes me to changing minds, and then we need to change hearts. And I do believe that we have to incorporate more social emotional learning in our schools. We need to have a conflict resolution, how to have constructive conversations with some people. Also, behavior modification needs to be incorporated in schools. We also need to have not only behavior modification, constructive conversations, but also the idea that we're not going to always agree with everyone. That how do we deal with conflict? How do we have these healthy conversations? That's so important. So on the systemic level, there's all these behaviors, but
right.
on the individual level, one of the initiatives that the foundation is promoting is upstander behavior. Because in a bullying situation, there's always three components, we believe. There's the aggressor, and there's the target, and there's also those watching, those bystanders, those passive bystanders. And we want to empower those passive bystanders to become active upstanders.
So tell us more about upstanding behavior.
Sure. So an active upstander is someone who can interrupt the situation if they feel comfortable, whether that interruption means even a simple just walking the person being targeted away from the situation, as opposed to letting them stay in the one place, as well as sometimes it's your own friends that are using homophobic slurs or racial slurs, and it's just like calling that out with your friends. You know, that's not acceptable. That those words aren't terms that we use here. Or even maybe sometimes they might use words that they don't even know the meaning of.
So how would you recommend that, for example, parents or people at schools or other people support, for example, LGBTQI plus youth?
Right. And also, going back to the upstanders, we have to inform a trusted adult. I just have to go back to that. Because we don't want youth coming into harm's way, and we also want to interact and reach out to the person being targeted to know that there are resources and support. And how parents and adults can support a child. I do believe at our core we all just want to be loved, and we also want to belong. So to foster a loving environment is to certainly create good communication skills, to listen intently, to actually be an active listener, which I think most of us do not actually possess. We're always thinking about, what are we going to say 2 minutes from now? What's the next conversation? And we also want to make sure that our youth feel connected and feel like they belong to a place. So that might mean if there is no GSA, making sure, first of all, that there would be anti-bullying policies at a school. Be an advocate for your child. The anti-bullying legislation, as well as having a GSA in the school. But if not, maybe it's about going with your child or going with your friend to a Pride event. What better place to meet people than at a Pride event? Have a presence at these events, or maybe even go to a conference. And you might meet people that don't live within your proximity, but in this day and age with Zoom and FaceTime, at least you can stay connected to someone. It's all about connection. That's so important.
So we agree with you completely. It's all about connections. I do want to point out, there's a study from the Trevor Project that says that for a LGBTQI plus young person, that having one supportive adult, now it might very well be a parent, but it might not be a parent. It might be a teacher or a coach or someone else that they know, that having that one supportive adult can make all the difference, which makes those Don't Say Gay bills so difficult and destructive.
Absolutely. And I'm also a very visible person. So for me, it's about having visual signs in your space. Maybe in your home, fly a pride flag. Or maybe it's about giving your child a visible symbol of something to remind them that they belong and they're not alone. I had a very interesting person, a very loving person, who bought this at an auction at one of our foundation's events, and then she presented it to me saying, I'm giving this to you so that whenever you see it, you know you're not alone. It was such a valuable message to get, and every time I look at it, I wear it's probably too expensive for me to take places that I do wear it to, but I need to know I'm not alone, especially when she gave it to me. It was early in my journey, and I did feel very alone, and I did feel very desperate. So it was a good reminder, yes, I'm not alone.
What an amazing thing for someone to do.
So
isn't that wonderful?
Give somebody a symbol, something.
A symbol. So, we're in Pride Month, and so I like to ask everyone, what does Pride mean to you?
So Pride means is a very joyous event of coming together, I believe, of a very resilient, resourceful, strong, vibrant, usually fabulously gorgeous community.
Of course.
But I do think it's about community. But it's a community of individuals. We can't give that up, and why can't we get that out to the broader community, of
right.
the broader world. You know, it's individuals with unique differences that make them special and precious, but come together to celebrate how wonderful they are. And it's also about remembering the hardships
Yes.
of people that have gone through
Yes.
such great discrimination
Right.
and inequality and injustice, but persevered. And it's that perseverance. And I must say, for me, I always think of things a little bit through Tyler's eyes, and I always wonder, you know, what his experience would have been, because I don't think he ever experienced a full pride. I think he was still so closeted and so frazzled and anxious that he didn't come around to the other side, and that breaks my heart.
Yeah. But thank you so much for all of your fantastic work in Tyler's memory and on Tyler's behalf to help so many people and to work towards the common good. Thank you so much.
Positive response from the actions that we're doing.
Absolutely. I feel very confident that there are from the work that you are doing, again, in Tyler's name and in his memory.
Thank you. You're so sweet.
Thank you so much for being here. So thank you so much. We're really pleased that you were here for this fantastic conversation with Jane Clementi in Tyler Clementi's memory. And we're stronger together. In this time of pride, we are stronger together. And please remember, it's all about pride.
Produced by the U.S. Department of Health and Human Services.